Welcome to our 5 on 5. We're pleased to be joined today by Cindy Fletcher, the Director of Programs for Susan G. Komen of Oregon and Southwest Washington. Cindy, great to see you. Thanks for being here today.
Thanks for having me.
So, let's get a little background first in case people don't know. Tell us about the organization and what you do there.
So Susan G. Komen is an advocacy organization that works in the breast cancer arena. So I am Director of Programs, and so I'm in charge of everything that is mission-driven in the organization, so our education, our outreach, our advocacy, survivor support, all of the programs that we raise money in order to fund.
Okay, and so you're here in Southern Oregon now. You're kind of doing a tour of the state, if you will. Would that be the proper way to explain it?
Yeah, we're doing a tour of Southern Oregon. We started in Roseburg, hit the coast, and are now in Medford and Klamath Falls, and we are meeting with hospital systems and community organizations that are working in the breast cancer arena, making sure that we understand their programs, the challenges that they face, and making sure that they understand and know of the programs that we have, because we have some programs that are available to their patients throughout the state.
Okay, and yeah, one of those I want to ask you about, the Treatment Access Program. Explain how that works and how people can be eligible for reimbursement.
So we have this fantastic program called Treatment Access because we know that much of the state of Oregon is living in a rural community where they have to travel long distances in order to have medical care. And so if a person who is undergoing breast cancer treatment has to travel more than 25 miles one way in order to get treatment, and they are at or below 250% of the federal poverty level, we have the Treatment Access Program, which allows them to receive gas cards, food and lodging gift cards, up to $400 per distribution, up to $1,000 in a year, which can really help if somebody is going daily, having to drive daily an hour or more, whatever it may be, to go to radiation or to go to chemotherapy treatments. So the person, and if somebody's in this situation and wants to take advantage of the program, they can call 211. The organization that administers the Komen program is called 211 Info. So they can call 211 and get that information. Basically what happens is their social worker, nurse navigator, physician, whatever their healthcare provider is, will fill out a form that verifies that they meet the requirements and send it into 211 Info. Wow. 211 will facilitate getting them a gas card within a week.
Wow, very nice turnaround.
So it's fantastic. Quick turnaround. It makes a big difference, and we really just want to make sure that people are not making the choice between having food on the table and going to have the radiation treatment, because it's so important that folks that are diagnosed with breast cancer have treatment and have it as soon as possible.
Certainly. All right, we're going to take a quick break. We'll have much more in just a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Cindy Fletcher from Susan G. Komen. So, how is the money for the organization spent? How much of it is research and helping people get access to care?
So we have 4 priorities at Komen. We've got education and advocacy, survivor support, treatment support, survivor treatment support, research, and advocacy. And when we have a fundraiser like a Race for the Cure, or if somebody's donating money to us, 75% of that money stays local and funds programs like the Treatment Access Program, free mammograms, community outreach that where grassroots organizations spread the word about the importance of early detection and screening. And 25% of it is sent back to the National Komen organization and is pooled with all of the other affiliates in the country into this pot of research money. Okay. And then that research money then gets sent is awarded in grants to research institutions around the country.
Certainly.
Oregon is incredibly fortunate. We've got the OHSU Knight Cancer Institute, and we've got the Providence Cancer Center Research Institute. And so we have actually received more money in our region back from research than we have given to national.
Wow.
And so we've got an incredible return on our investment.
Excellent.
As far as that goes. And so the 75% that stays local, like I said, goes to fund our programs, including portions of the state ScreenWise program.
Yeah, and so people can actually get free mammograms and talk about how important early detection is.
Yes, so the state has a program called the Oregon Breast and Cervical Care Program, which is now called ScreenWise. And a person who is, again, at or below 250% of the federal poverty level and does not have insurance or is uninsured can contact 211 again and get connected with a ScreenWise provider that will then give them a free mammogram. And so that is a fantastic service for the community. And Komen for a long time has been a major funder of the program. And now, as we have in our advocacy efforts advocated for the state of Oregon to fund the program, we have been able to pull back some of our funding towards education and outreach and bringing people in to get screenings, as well as to fund pieces of the ScreenWise program that are not otherwise covered by the state or by the federal government.
Wow.
So we fund genetics testing, genetics counseling and testing through ScreenWise, which is amazing and revolutionary, groundbreaking in the breast and cervical care program world.
Wow, yeah, a lot of programs available for people. Call 211 to find out.
Yeah, and
Very
then as far as information on all of our programs, you can go to people can go to KomenOregon.org and find out all the information and contribute if they would like.
Very nice. Great to meet you, Cindy.
Thank
Thanks
you
so
for
much for
having
being
me.
here. Appreciate it. Stay with us. We'll be right back.